back to Digital Mental Health Musings for 2022, and I'm really excited to welcome Dr. David Bakker to the podcast sofa, if you like, or virtual room, to continue our discussion around digital mental health tools that are available both for practitioners to use and also for consumers to use as standalone tools. So welcome, David, and thank you so much for joining us.
No, thank you for having me.
So before we start chatting a little bit more about the apps that we're going to talk about today, a bit of a background to David. So David has a doctorate in clinical psychology from Monash that he finished in 2018. And a focus of a lot of that research was around the use of mental health apps and specifically the development of, you might correct me if I'm wrong here, either one or two apps called MoodPrism and MoodMission. Sort of what drives him is making evidence-based psychological techniques and mental health education more accessible in the public sphere, especially important at this current time when, we still have extensive waiting lists for psychologists. So access to mental health support is a real challenge. So David's also, aside from being a research academic, a clinical psychologist who's working in Hobart, which is a beautiful part of the world, where he uses CBT, the evidence-based therapies, in his work with his clients. Anything that I've missed there, David?
No, I think that's a good summary. Yeah, absolutely.
And primarily worked in Tasmania, is that correct?
Yeah, so I grew up in Launceston.
Yeah.
And then I studied undergraduate in Hobart, went to the mainland for postgraduate studies, had a few years working in mental health outreach before I went over to Melbourne.
Okay.
But yeah, so studied Doctor of Clinical Psychology at Monash and then moved back to Hobart after that because it's, as you said, a wonderful place to live and lots and lots of demand for psychology services down here.
Yeah, absolutely. So currently balancing clinical work with academic work?
Yeah, a bit of both, but primarily in private practice. And while also running MoodMission simultaneously. Which
segues really nicely into sort of, I guess, the first question. It'd be really nice to get a sense of your, let's say, your sort of pathway or journey, if you like, into digital mental health and what influenced the development of MoodPrism and MoodMission.
Yeah, absolutely. So I started my doctoral studies researching with Nikki Rickard at Monash. And she was at that time getting a project off the ground, which became MoodPrism. So that's an app that is used for tracking moods and like creating like a sort of a colorful mood diary as you answer questions every day about how you've been feeling. Yeah. And so that project was our lab group's project to try and collect a lot of rich data from people on their phones, kind of like an ecological momentary assessment, experience sampling methodology sort of research approach, where traditionally someone has like a pager or like a Palm Pilot or something old school like that. And then when that goes off, they rate how they're feeling. Yeah. We were trying to develop an app that does the same sorts of things. And I suppose while we were getting that project off the ground, I was thinking about something that could be a bit more clinically focused and a bit more practical, and looked at the market of available mental health apps and saw a gap there for something that would be like a one size fits all. Like you go to the app, you say how you're feeling, and it gives you some evidence-based strategies of how to feel better. Yeah. There wasn't really anything like that in the market. So that was the idea for MoodMission, which we did some crowdfunding to get off the ground. I was successful doing that, which is really cool. And developed the app based on some evidence-based research that we had done previously as well, like that provided us with some recommendations for developing mental health apps. Yeah, and then we studied the app for the papers in my doctoral thesis as well and published those too. So MoodMission continues to be available now. MoodPrism does as well. And they're both on Android and iOS app stores. And I think that's one of the strengths as well. Like we know that a lot of these sort of apps are developed and studied, but they're closed down when the funding runs out or whatever. Yeah. And we, from the start wanted these apps to have a life after the research projects that had funded them.
Okay. So I guess in line with that, because I'm thinking that there's really been, as you're probably well aware, an exponential growth in apps and services, online resources, especially as a result of the last few years with COVID and everybody shifting to telehealth. The apps you're talking about were developed prior to that, like a number of years prior to that. In terms of the sort of ongoing growth, where do you see these fitting in terms of delivering support to people in the community in that sort of bigger picture?
Yeah, we wanted them to be as flexible as possible. So they're not, of course, they're not replacements for professional support completely. You can't really have an app that does that unless it's like got some sort of very strong integration with a professional. And so we were trying to design an app that would really harness the strengths of apps, which is that everyone's got a phone, it's in your pocket, you can use it at any time in the day. So eventually we build something that could be preventative and could help like non-clinical populations, but also could be used by psychologists and by clinicians to fill in the gaps in therapy to do the strategies between the sessions, basically. So we didn't design it specifically with like a very narrow user case in mind. We made it quite broad deliberately so that it can be used across multiple different situations, because that was one of my frustrations as well. Like you download these mental health apps and you're like, oh, this looks cool. Oh no, wait, this is like for some like really narrow little purpose, which is great if you're maybe a clinician or you just happen to stumble across it and it happens to be, applicable to your issues. But we wanted to make it something that, you download and then most people can get something out of this regardless of their mental health status.
Yeah. So in line with that, I guess it'd be interesting to know sort of the demography of the people that are downloading the apps, because I think there's often an association around the younger population, adolescents, young adults. What are you finding in terms of your user statistics, if you like?
Yeah, I think things have changed recently, because it used to be a free app and then we had to change it to a paid app just to keep the lights on, basically. And it's still a social enterprise, so everything that's raised from the app just goes straight back into funding the development of it. But I think initially when it was free, we had more younger users, and now it's paid, it's slightly older. There's a really broad range of ages. I think most users are in sort of the early 20s, but that curve goes all the way through to, we've got users who are 70 and 80 years old. So we wanted to make it usable for all ages as well. And we didn't want it to be like restrictive in its language use, because I think as well, young people don't like that. They don't like being treated like they're young. They want to be using a tool that seems just like natural and easy to use. So it doesn't have it doesn't have an approach. It's quite neutral in flavor. But most of our users, we design the app as well to help young adults who are like leaving their support structures, like their high school or their parents or something like that, and they're going out to find their own coping strategies. So, one use scenario would be you've moved from Tasmania to Melbourne to, go to Monash, let's say, and you're in your first year of uni, and all of a sudden you can't talk to your mum and dad every day over the dinner table. You've got like all these other stresses going on. You're in a whole new place. You don't have your dog there that you usually find really helpful. You have to organize yourself for all your lectures. Like there's a lot. So we're trying to help a user like that find new and better ways of coping, rather than going to the other ways of coping, which would be you get really drunk all the time, or you shut yourself away, or you watch 3 seasons of some TV show and don't leave your room for a week. We're trying to help that person develop new and healthier ways of coping. So any person in that sort of situation, which is, predominantly a lot of the people who we see as psychologists, the people who something has happened in their life that has disrupted their coping style, whether it be any sort of like moving away from home, or death of a loved one, or they've lost their job, or anything like that. They've got to find a new way of coping, and that's what CBT really focuses on, really. So we're just trying to break that down and deliver it in really little bite-sized, easy to use chunks through MoodMission.
Yeah. And I'm thinking in terms of that, is it that sort of intuitive element whereby it kind of, like apps often, a bit like Spotify, it identifies the stuff that you routinely like, so it begins to suggest similar things?
Yeah, that's another feature of it. So there's like a machine learning algorithm in it, just like Spotify or Netflix, where the more you use the app, the better it gets at guessing what's going to help you. So let's say, for example, you go to the app and you say, hey, I'm worrying about something. My thoughts are really occupied on something that's making me feel anxious, which you can basically by answering three really quick questions. Then the app will go, okay, what are you about to pick? And if you pick like exercise and you complete it and it seemed to be helpful, then the app will start to suggest more exercise the next time you come back and say, hey, I'm anxious and I'm worrying about something.
Yeah.
So the next iteration of that is to further develop that algorithm so that just based on some of the questionnaires that you complete when you onboard, it can just start right away tailoring your mission suggestions to user profile.
Yeah.
And we're doing a little bit of research with a lab group out of Germany that is focusing on that at the moment as well, and is towards developing that sort of use scenario as well.
Okay, nice. So it's still very much work in progress by the sound of things to some extent.
Yeah. With the limitations of funding, I think that's the difficulty when it comes to this sort of stuff. Yeah, we're all believers in making it a social enterprise that prioritizes it being evidence-based and research-driven before it then being a money-making operation.
Yeah.
There's so many apps out there that you can see in their design philosophy. Absolutely, they're helping people, but there's a priority really given to how can we make money off users. Which makes perfect sense if you're running a business like that you want to expand. But we're trying to make MoodMission a lot more focused on whether it actually works and how can we make it easy to access and not charge an arm and a leg for an ongoing subscription or anything like that. It's difficult to make those changes then to the technical parts of the app when you've got limited funding like that, but we're doing the best we can.
Absolutely. And I guess in line with that, sort of what's coming to mind, because obviously at MPRAC, we're across a lot of the apps and programs, and a lot of them are, or the majority are, there's no cost associated, but there's also that sort of flip side where some do charge even a minimal fee, with the rationale being the motivation to engage is slightly different, because you're paying for something, really. Have you found a difference in terms of engagement with the app from when it didn't have a cost associated with it?
Absolutely. And that's what we found, that when it is costing something, the users who do have used the app more because they have invested already into it. We have toyed around with the idea of making it a subscription model rather than a one-off payment model. But then that comes with challenges as well about extra technical development, but also the ethics of like, if you pay for it once, then you're probably going to have this investment to use it, and it's always going to be there. And if you 6 months down the track want to come back to it, it's there sitting there for you. Like, and 6 months down the track, you might hit a bit more of a slump. And if you come back and you go, oh, I have to renew my subscription, it's going to cost me another $6, or for some of these that's $15 for the next month. No, maybe it won't. It could cause that sort of friction as well. So, but we have found that since implementing just a one-off payment, I believe in Australia it's $7 on Android and $7 on Apple, then the users who we do get are much more invested, and they use the app more, and they rate it as more helpful. So
it's such a fine line, isn't it? Just listening to you speak then in terms of the benefits and the sort of risks associated with adding charges but maintaining engagement, I suppose.
Definitely, yeah. And I suppose it's one of those things that is constantly having to be readjusted because our attitudes and our relationships with our phones are constantly changing over time, depending on what the other apps are doing and depending on, I suppose, just general factors in people's lives. But for example, most apps were free, a few years ago, and now most mental health apps have some sort of subscription element to them. So the idea of a subscription is relatively new in the app landscape when you compare it to the history of smartphones. And as well, like across different countries, I've heard that people in Australia and the US are very reluctant to buy something one off. Yeah. Whereas users in the UK, like, they acknowledge that if you want a decent app, then you should pay for it. Yeah. So there's a bit of a different attitude towards the initial downloading of the app as well. Yeah, so it is really difficult to try and strike a balance. And I think different systems work in different situations. Yeah. But yeah, maybe it's just about testing out what works and what makes sense ethically, as well as from the point of view of results.
Yeah. And I guess that leads me into the question, because you kind of talked about the differences in different countries. So in terms of the user demographics, this is global. You've got people not just in Australia, but elsewhere.
Yes, yeah. So it's internationally available. We've got users all around the world. We've got some like research collaborations as well. Yeah. Where they're recruiting participants for studies using MoodMission as a condition in the UK and in the US. So yeah, it's nice that we've built something that is accessible in that sort of way. Yeah, and all the content in it is really broad and accessible. The only Australian, I think, specific stuff is there's one questionnaire that's not compulsory. It's an optional questionnaire that has a few questions about like mental health services in Australia. Yeah. But apart from that everything else is like internationally applicable.
Yeah. And what sort of population groups are you sort of looking at within those research projects, in terms of what, mood disorders or more prevention? I know you mentioned prevention before.
Yeah, I think it's interesting looking at the research and how it's neatly divvied up into like whether people with major depressive disorder or anxiety. I personally have always reacted quite negatively to that, because in clinical practice, you very, very, very rarely see someone walk through your door who really clearly meets diagnostic criteria for one disorder, and you can see in your mind that the treatment that is indicated for that disorder is going to work in the same way that it's described in the manual. Mm-hmm. My approach to the research from day one was, does it work for anyone downloading the app? Like in the messy, complex lives that we lead, is this actually going to help? Because I've sort of frustrated when you read a paper and they magically find a group of people who only meet diagnostic criteria for major depressive disorder and nothing else. Who would have thought? Like, that doesn't exist. And these people are magically like so motivated to engage in this therapy over 8 weeks that is quite actually invasive. And again, like those people in clinical practice are so rare and few and far between. I'm sure they do exist because there's studies are on them, but it's very, very hard to apply that to general, like ecological validity of actually what works in the real world. So I think we always put those sorts of assumptions aside and just said, okay, we'll just make it available and we'll just study whoever downloads it. And that's what I think a lot of the research groups as well have had that approach to it. We do have some questionnaires at the start, like one on depression and one on anxiety, so we can get like a picture of the sorts of users that are downloading it. And I mean, this paper that we're preparing with this lab group from Germany at the moment is breaking down the users into categories of like whether of severity on their anxiety and depression questionnaires, and seeing how those different groups respond in the app. So yeah, we can do that post hoc. We can just like see what they scored on the PHQ-9 and the GAD-7, which are depression anxiety scores, but we're not trying to target specifically like whether it's going to work for major depressive disorder or whether it's going to work for prevention or something like that.
Yeah. So I think that's really interesting as well, because as you're probably aware, a lot of the dialogue around where digital mental health fits in the primary healthcare space is at the sort of lower levels of the step care framework, prevention, mild symptomatology, but there's also that school of thought that actually it fits across the spectrum, because as you said, people have, or across the step care model, because people have will have complicated lives, messy lives. We don't rarely present with just this neat little box, that doesn't fit into the step care.
Yeah, and I see clients who are working jobs and have functioning families and things like that who score in the severe categories on depression and anxiety measures. So technically they shouldn't be at the step care model, but like in the lower levels. But to say that they don't have a phone or couldn't use a phone effectively or couldn't use an app like MoodMission effectively is a bit ridiculous. Of course, if someone's in really acute phases of mental ill health and they need daily intervention with a mental health professional or something like that, then that's a different sort of thing. But still, I imagine that a lot of people in inpatient settings even are using apps for wellbeing tools. So I think it has use across the spectrum, but the strength does of course also lie in the gaps in our services, and the gaps in our services are in the lower levels and the preventative space. So of course, let's develop there as well, but let's keep it usable and accessible for everyone.
Yeah, I'm thinking from the health practitioner perspective, if you've got somebody who's presenting with a whole range of complex issues, a lot of practitioners, myself included, use tools such as these as an adjunct to the face-to-face. So, maybe you're focusing on one thing in the face-to-face sessions, but you're using the app to actually teach skills and begin the work around that as a separate thing. So you're really maximizing the time and opportunity you've got with people. Is that what you kind of find in terms of your use of or recommendations of this or other practitioners?
Yeah, definitely. And I think the one trap that I'm very guilty of falling in though is, of course, leaving it to the last 3 minutes of the session to be like, oh, by the way, you should download this app and use it between now and next time, which is always going to fail. Well, not always, but most of the time. The approach that I take, I'm a little bit reluctant myself personally to recommend MoodMission, just because there's a little, I think it activates one of my schemas that I shouldn't be self-promoting, but when I do, and when I also recommend other apps, then it's part of the homework setting exercise. So downloading the app with them in session, escorting them through the onboarding, suggesting how they're going to use it, all of that's important. And in MoodMission, there's actually a capacity to enter your own missions. There's an in-app purchase where you can make your own missions. And so that can be used in that context where you can be like, okay, so we've agreed that you're going to do deep breathing whenever you start to feel like you're about to have a panic attack. How about we go to MoodMission right now and we create a deep breathing exercise, and it's one that's unique to you, and we can use the language that you like in it, and that sits on the mission selection screen whenever you use the app. So it's sitting alongside the other 5 which are semi-randomly suggested to you, different sorts of strategies. So that's a good way of integrating MoodMission into a clinical framework where you can use it as as a reminder for the mental health and wellbeing homework that you've set. But the users might discover as well in the mission suggestions that the app throws at them that, I don't feel like doing deep breathing right now. Maybe I'll do some exercise instead. And I think that's one of the advantages. When we're clinicians, we're trying to guess what's going to work for this person in their life, and often they'll come back and they're like, they've forgotten about it, or it didn't help the first time, so they didn't try it again, or maybe they try it and it actually has a bit of a negative effect, or so so MoodMission helps give you the suggestions that maybe you've agreed upon in therapy, but then also throw at you like a whole bunch of other evidence-based stuff, and clients will recognize what works for them. And I think their confidence in how it's going to work is incredibly important. So if they pick it and they're like, yeah, this is going to work, then it's much more likely to work than something that we've prescribed them.
Absolutely. Yeah. And I guess I'd be interested to know, to some extent in line with that, because you just described using it as an adjunct, really, but it's also a tool that people can have once they've exited the service, or maybe they're waiting to come in. What do you find in terms of the data that you have about people revisiting the app? I mean, I'm assuming there's like a average length of time that people engage, and then maybe things are all going well, and you mentioned before, then something will come up, so they've still got that toolkit, if you like, in their pocket. Do you have any figures around that?
It's hard to say, not off the top of my head.
Sorry.
but yeah, I think there are certain sorts of users. There are ones who will use the app once and forget about it, never come back to it, and we know that that's probably the majority of like app users. I've had comments on like the retention rates and like the attrition rates at conferences before, being like, these are so high. And it's like, yeah, that's apps. Like, I think it's something like ridiculous, like 5% of users will use it after day one for all apps, like regardless.
I'm thinking about my own phone right now. I have so many apps on there that I would have downloaded and not used.
Yeah, exactly. Yeah. But then there's other sorts of users who we do know keep coming back time and time again. We've done a bit of research as well to find that I think if a user engages it with about 8 missions over time, then they get a much bigger effect size than if they just engage with one.
Yeah.
I think that it peaks at about 8, and then I think we sort of level off 9, 10, 11, 12 sort of thing. But yeah, essentially the more missions you do, the more use you get out of the app, the more effect on your depression, anxiety. Yeah. And yeah, there's certainly users who have done hundreds of missions as well, who've just used it like over a very, very long span of time. We didn't necessarily want it to be something that lots of users would end up using for a very long time. We wanted it to be like you go to it when you have an issue, sort of app. And that means that, if you stop using the app, maybe things are better and you don't feel like you need to use it anymore. And great, like that's kind of like, maybe you've learned a few coping strategies from the app now, and you know now that you should go for a walk every day or something like that, and that just helps. So we're hopeful, I suppose, for those sorts of users who visit the app a little bit and then go away, because I mean, some of the research that we found shows that even doing 1 or 2 missions will produce a good effect size.
Yeah. So it's just supporting behavior change, really, to some extent.
Definitely.
It's a very simplistic description, but using it as a tool to, okay, what works, what's not working, and just engaging with that consistently until it just becomes the go-to.
Yeah, exactly. And I think a lot of benefit that people get out of psychology, that they at least report, is that they just learn like 1 or 2 little things that they need to change. And it's very difficult to remember and act on like heaps of things from therapy. So if you just focus on 1 or 2 little things that as a therapist might break some of the vicious cycles that the person is trapped in, then you can get great results. So that's the same thing with MoodMission. If they take away 1 or 2 things that they have learned from it, sure, they might do a little bit of unconscious learning and like a bit of like engaging in that way as well. But consciously, if they're like, oh, now I know that deep breathing helps me, or now I know that yoga might help, or now I know that I can use an alternative thought, then great, then the app's done its job.
Where you see sort of the ongoing development of digital mental health tools and resources, given that, Australia, I think, is at the forefront in terms of development of these apps and programs. And it's really shifted the train of thought due to COVID in terms of delivering tools and resources online. Where do you think it's going to go from here? I mean, there's obviously the aim from a perhaps Department of Health perspective is around integration into routine healthcare, and also for people to be able to self-manage. What do you think in terms of what do we need to do, or what needs to change for that to happen? Or do you think that's even worth considering? It's a big question.
It's a massive question, yeah, but I think it's a really important one. I would like to see I think there are a lot of companies and organizations that have developed tools for our phones that are not helping. And I'm thinking about a lot of the stuff coming out about how our attention is being sapped away from us by social media.
Yeah.
And these huge companies who sole purpose is to capture our attention, and we're the product, we're not the customer when it comes to these platforms.
Yeah.
So I think, yeah, absolutely, like we can aim for some sort of integration of digital mental health into the system that we've currently got, but I think the real change would come from limiting the negative effects that those sorts of organizations can have. Because when we're talking about using phones, it is a competitive landscape, and whether someone's going to use a mental health app or they're going to go on Facebook, it's a competition essentially for attention.
Yeah.
So yeah, I mean, that's just one thought about that. I think it's a really complex issue when it comes to like how we're going to integrate things, and but I think there's also a lot of work that needs to be done just in the mental health system. Just, I mean, as from the perspective of a psychologist, it's already so convoluted, and like how people actually get in the door to see you, unless there's some really big rework of like how psychological services are made available to the public, then it's going to continue to be fragmented and a bit awkward. And yeah, so I think the focus on how people are using their phones currently and whether that's good or bad for their health and their mental health is also a really necessary part of that picture.
Yeah, absolutely. And I'm wondering as well, in line with what you're saying there, the approach that we've taken at MPRAC to a large extent is that sort of top down. We provide a lot of training and awareness and et cetera, et cetera. There's then the argument about, okay, what about when we're training these people? That's sort of bottom up. We integrate it into programs, degrees, postgrad. What are your thoughts around that in terms of it becomes just normal practice then, business as usual? Do you think that's the way to approach it? Or,
Yeah, I think so. I think that would be important. Although I think the logistics of rolling out supports are also a really important part of training. So I suppose what you're touching on there is that as well, like having training about, well, this is how you could integrate an app into your practice, or how you work with clients using an app, but also this is how you operate in an organization as a psychologist needs to be a really important part of training too. And I think I've learned, I learned a great deal about that at university, but not until you're actually in the workplace and in a placement, for example, do you start to learn really what goes on and really how to engage with clients. So yeah, if it's integrated with the way that large practices work, or it's integrated with practice management software as well. I do a bit of work with a group called Tacklet, who are basically making practice management software, which is just amazing for psychologists. And there's some integration there that could end up looking like a really end-to-end solution of like, how do you track someone's progress over time, but also how do you deliver homework to them remotely? How do you manage all their appointments? How do you do all that sort of stuff? So I think if there's some sort of practice management solution that works across different care settings, then that can also be a way of integrating it all. And also, training people as they're entering or before they enter the workforce, that this is the way we do it. Like, we use this online portal and we deliver psychometrics in this way, and we get them to do these things before they come in, and get them to do these things while they're here, and get them to do these things after they leave.
Yeah.
Then that would make a lot of sense to me.
Yeah, I guess because when you're using it as a practitioner, it can feel a little clunky, because you need to have obviously the iPad or the phone or whatever and talk someone through, and then it gets emailed to them. So it at a systemic approach, I guess it's at a systemic level, it's difficult and a bit messy. But I think you've captured the complexities around trying to integrate digital resources routinely. It's just we've come such a long way, but we still have a bit of a way to go.
We really have. And I like to think a lot about how we actually engage with clients, because I think that's part of the therapy as well. So what is their very first contact that they have with you? What sorts of email communication they're receiving? Like, how did they feel when they got the referral to see you from the GP? Like all of those steps are a really important part of it. So I think psychologists and mental health professionals need to embrace that. That's part of their job too. Like, this isn't fringe stuff. Their job is, as soon as that client walks in the door, or even before that, as soon as they hear about that service, then you have to manage every single step of their engagement. It's not just the 50 minutes that they're sitting in front of you, but it's every single step of engagement. And so if as psychologists we can step back and be like, okay, let's just think about this. Like, what would someone in this client's shoes want from this service? All along the way, we want it to be seamless. We want it to be like easy to use. We want it to seem private and confidential. We want all of that stuff. Then I think it makes it much easier then for it to feel less clunky and feel like it's part of the job. Like, it's actually part of the job to do these things.
And I think that's the flip side of, to some extent, touches upon the flip side of this, which is that we've talked a lot about the practitioner education and awareness, but also the consumer perspective, because there is very validly a concern around safety and quality of data.
Exactly. That's really important to us as well. At MoodMission, everything's de-identified, but of course there are still concerned users who are like, well, I don't want it to be collecting my data. So we need to make that completely transparent and clear, how we collect the data, what sort of security is involved there. And we want psychologists to feel confident in their own knowledge about like what security means in the digital landscape. So that sort of training is important too.
And that's a whole different level of training, isn't it, I guess? And maybe coming out of the quality and safety standards, there may be something around supporting practitioners in that sort of level of understanding.
Definitely. That would be useful.
I guess before we finish up, it would be really handy, I mean, we've talked about an awful lot in there, just to sort of condense for practitioners who may be watching this and are thinking, I'm really keen on maybe trying to integrate MoodMission or Prism or something. What would be your top tips for people who are thinking about moving into this space?
Tip number one is download the app and try it yourself. So see if it makes sense to you. And if it doesn't, like, start to either provide feedback or start to think about, okay, well, how could I introduce this to a client so it would make sense to them? That's the golden rule. I think you need to try out it's the self-practice thing. You need to try out the interventions on yourself. Not only to understand how it's going to benefit your client, but also to understand like the logistics of it all, and to see like whether it's easy to use. And then I think after that you can consult with organizations like MPRAC or like with looking at the information available, or Cyber Guide, or places like that which rate apps and do the research for you. So rely on those services as well. But I think those are the two main. Before we get into specifics, they're the two main pieces of advice. But mainly, download the app and try it yourself.
And I might just pull in one of the points that you made before around the support, not leaving it to the last 3 minutes of the therapy session.
Yes.
Yeah,
It's part of, it's definitely part of the intervention.
Yeah, and I think that's a really hard one because we have such a limited window of time that there is a tendency, for me, I've learned this as well, to underestimate the value of that engagement with the person you're working with and the help in setting up and talking through it. So that's something that probably, I've just thrown my own tip in there. Sorry.
No, I think that's a really good point, and you can weave it into your session in a very seamless way. Like it'd be part of your assessment, even like just to see how someone interacts with their phone can be a really interesting part of your therapeutic assessment as well. Like, is this someone who uses the calendar in their phone? Are they well organized? Is they someone who regularly contacts friends and family? Would they be open to using their phone in a new and different way? Like those are all parts of your assessment too. So it can be woven in really nicely. It doesn't have to feel like this like extra bolt-on thing that you have to cram in at the end of the session. It can be part of it.
Yeah, and I think that's part of the key area of work that we need to do in terms of the integration, is seeing it as an integrated part and not an add-on. It's something that's there that we can just integrate.
It's very important.
Before we finish up, is there anything that we've kind of not talked about that you think it's useful to mention while we're on?
No, I don't think. I think we covered lots of interesting topics, lots of ones that I didn't expect. So thank you. I think I would love to hear from anyone who's interested in this space as well. Feel free to reach out through MoodMission or wherever, because at the end of the day, it's about creating networks in this space as well, and like having people who believe in the same sorts of advantages of digital mental health, be able to spread the word to their colleagues. So yeah.
Absolutely. And what we'll do as well is put up the links to MoodMission and the various key things that we've talked about in this conversation so people can easily access them. So for people watching it, the links should be underneath the window somewhere.
Cool. Awesome.
All right. Thank you so much for your time, David. It's been an absolute pleasure to talk to you about the apps and sort of your experience with them and how people can use them. So it's very much appreciated. Thank you.
No worries at all. Thank you so much for the opportunity. And thanks again.